Mr. Chairman. I want to thank you and Ranking Member Murray for holding this hearing. I want to thank all the witnesses who are here today because I know how hard you're working on this issue. The opioid epidemic, as you all know, is absolutely devastating my state of New Hampshire. And it's not something we're going to fix overnight. We didn't get here overnight. We're not going to fix it overnight. One of the things that I think we really have to continue to focus on is that addiction is a chronic disease, and we need to realize the long-term nature of it, because the reality is that part of this disease is relapse. The disease is multifaceted, and it's often made worse by the underlying trauma and mental health disorders, and on top of that is complicated by co-occurring medical diseases, like ones that are spread by injection drug use, like hepatitis C and HIV. I was on the phone with a friend of mine who lost her 34-year-old son about a week ago. We're not sure yet whether it was an overdose or a heart event, a cardiac event related to substance use disorder. But this is the type of ongoing issue, along with long-term societal issues. We have teachers now who have children in their classrooms whose parents have overdosed. We have grandparents who are raising their grandchildren. We are in this for the long haul. And so one of the things I want to emphasize is that while I appreciate greatly what the four of you and all of the people you work with are doing, the Trump administration's interest in repealing Medicaid expansion, which has been the critical #1 tool in my state for getting treatment to people, and its proposed budget really would undermine our efforts to combat this epidemic in our states. So I hope that while you're all doing this work, we realize that in the bigger picture, the budget and the interest in repealing Medicaid expansion really poses difficulties for those of people on the ground trying to get treatment to people who are suffering with this disease. Dr. Gottlieb, I appreciate very much the work you've been doing. When you were last here before this committee, you agreed that there was an outstanding question about the nomenclature we are using in the term abuse-deterrent formulation and whether it's conveying the right message to providers and patients, and I was glad to hear you speak about it just now. Senator Young and I sponsored the Opioid Addiction Risk Transparency Act, which was recently signed into law, and really is intended to make sure that health care doctors and in turn patients are provided with information about the limitations and patient care implications of opioids with so-called abuse-deterrent formulations. So now that the legislation's been signed into law and has given you the authorization, what steps has the FDA taken to use this authority provided by the Opioid Addiction Risk Transparency Act?
Thank you for the question, Senator. We set out probably about 4 weeks ago, to undertake a formal study of the nomenclature that we use and the lexicon that we use in describing abuse-deterrent formulations, and you and I have had the opportunity to talk about this, to make sure that we're not conveying to providers and patients that a drug that has abuse-deterrent features is less prone to addiction, because we know it's not. The abuse-deterrent features on the current drugs make them less prone to manipulation that allows them to be abused in ways through inhalation and injection, but they still can cause addiction. And so we're looking at this scientifically, and we should have that information back in a reasonable time frame, and I'd be happy to come in and talk to you about our results.
Well, I would appreciate that. I would just urge you, we are now giving you all tools to get information out there, and these drugs were approved without a full understanding of this potential impact, and I think just the more quickly you can move, the better off we will be, even as you're gathering data.
I firmly agree. I just want to make sure we're science-based, but we will move quickly.
All right, thank you. And Dr. McCants-Katz, we've talked a lot about the 2-year opioid state targeted response grants provided by Cures. I will say, like my colleague Senator Shaheen, who's not in this committee, but who's been leading the charge on this, I've got some real concerns about the formula used for 2017, because it didn't provide adequate resources to New Hampshire, a state with one of the highest per capita death rates in the nation, but only was eligible for $3 million of the $500 million available under the formula that was used. In addition, addiction is a chronic condition, so we need long-term investments to address the crisis. But aside from the Cures money, there are other important federal resources that we need to strengthen. And as was described in your testimony, the Substance Abuse Prevention and Treatment Block Grant is fundamental, but it really hasn't kept up with inflation in terms of dollars. So because I see that I'm running out of time, I'll just ask you if you can briefly speak to what SAMHSA is trying to do to address the significant decrease in value of the block grant today, especially in light of staggering increase for the need of such services.
So, thank you, Senator Hassan. So SAMHSA allows flexibility to the states to use the block grants for substance abuse prevention and treatment. So states present us plans, we provide them technical assistance, and we allow them to implement as they wish to do in their communities. And every state, of course, is different. SAMHSA also works with the states in terms of pretty extensive ways of helping them to look at how they can best provide care. So we have, in addition to funds that in these block grants, as you know, are the funds of last resort for individuals who are not covered by other third-party payers, including Medicaid.
We need to stick with the 5-minute time limit
I think,
closely.
thank you. I'll
I'm
wait
sorry.
for the second round and we'll follow up then.
Thank you very much, Senator Hassan.
Thank you, witnesses, for being here for quite a long time. We are pulling up the rear here, but we are very grateful for your fortitude, not only here today, but in your leadership every day of the week. So I wanted to focus on something that we are grappling with in New Hampshire. And Dr. McCants-Katz, this is really a question for you in particular in SAMHSA's role about the substance misuse workforce. Because when we discuss the opioid addiction epidemic, we talk a lot about improving access to treatment. But one thing I think we don't pay enough attention to is the insufficient infrastructure that makes expanding access to treatment such a challenge. Part of that infrastructure is the addiction treatment workforce. I hear often about the importance of integrating treatment into primary care. And while I agree that it's critically important, I also think we need to recognize that 90% of the addiction treatment workforce are non-physicians. All of these professionals are on the front lines of this opioid addiction epidemic. Stress is high, they are too often underpaid, and it means turnover can also be very high. So in turn, it's really hard to build a workforce with experience and firsthand knowledge. So I'm interested, Doctor, in your thoughts, in particular, what can SAMHSA do to help recruit, train, employ, and most importantly, retain the frontline provider workforce we so desperately need to treat this epidemic?
So you're right. The vast majority of people who will provide services to those that have substance use disorders will be non-physicians. And so SAMHSA has a number of types of training programs that do not just focus on physicians. Yeah. They focus on advanced practice clinicians, such as advanced practice nurses, nurse practitioners, physician assistants. We also encourage interactions and collaboration with our colleagues at HRSA, because they do have funding programs to train various types of healthcare professionals that SAMHSA does not have purview over, but we do work collaboratively with them, and we can offer different types of curricula for training. We work with national stakeholder groups that are involved in the credentialing of the various professions to make sure that that training on recognition and treatment of substance use disorders gets into the curriculum, and we will continue all of those efforts.
Well, thank you. Because it's running late, I thought what I would do is ask you all, because the record will remain open for some time, to just reflect on what it is that your agency isn't doing right now that it could be doing or should be doing to help us combat this crisis. And if you'd be willing to submit that in writing, I would greatly appreciate it. I would also just add that one of the questions I get on the ground in New Hampshire, and sadly this has been the focus of my work both as a governor and now as a senator for some time because of the nature of the epidemic and the mortality rates in particular in New Hampshire, is people ask me why we don't have more resources than we already do, knowing how hard everybody here is working. And they do ask me the question that relates back to the stigma that you talked about, Dr. Katz, that if this were a different kind of epidemic, would we have more money on the ground? Would we be having a debate at all about whether we needed more resources? And I think it's a good question. The people in my state have been extraordinarily brave, starting with parents who finally started writing obituaries for their children that said their son or daughter died of a heroin overdose. I mean, think about the courage that that takes, and the courage it takes for people to come forward to their elected officials and say, I'm in treatment right now, or I'm raising my granddaughter because my daughter died of an overdose last month. People have been willing to stand up and talk about this illness, and they're helping us understand it as the illness it is, but the stigma is still out there, and I hope that with every piece of energy you all have in the jobs that you have been entrusted with, you will speak to the need for us to devote resources to what is an epidemic, a disease that will include relapse and have co-occurring problems that will challenge us moving forward, and that it's not something going away, you know, in a year or two. We will stop, we hope, the overprescribing, and we'll get a better handle with training with our physicians. But at the end of the day, this is an illness. There will be other substances that may trigger addiction and other kinds of addiction going forward. And I just thank you for the work you're already doing, but I hope I can ask you to be even greater champions for the notion that this is an illness and that people need care. So with that, I'm going to turn over the gavel to Senator Warren, who will ask her second round and then close out the hearing. Thank you so much.